Hi everyone, I'm Dr. Deepika Gupta, practicing homeopathic physician since 12 years at Gurugram. Acute respiratory distress syndrome has increased because of the pollution in weather. I will give you 5 medicines which can cure acute respiratory distress syndrome. First is anti-Mars. Anti-Mars mein there is emphysema with excessive dyspnea and cough. There's a lot of mucus in the chest which the patient is unable to expectorate. Catarrhal pneumonia is there which is associated with influenza. बहुत important है. Pneumonia which is associated with the influenza in anti-Rs. Second is Rs iode. Rs iode में there is asthma which is worse on lying down. First lying down and there is lot of wheezing in the chest. पेशेंट को बहुत ज़्यादा वीजिंग महसूस होती है, आवाज़ आती है. देन देर इज़ pneumonia with mucopurulent expectoration. Dyspnea and night sweats are the characteristic symptoms of Rs iode. Of course, patient will be hot. Rs iode patient will be hot. He will be restless. And patient who has suffered from pneumonia that fails to clear up. पुराना pneumonia रहा है जो clear नहीं हुआ है. And there is audible wheezing in Rs iode. Then camphor. Camphor में there is always anxiety in the patient. डॉक्टर साहब मुझे कुछ हो रहा है, बहुत suffocated feeling हो रहा है, पता नहीं मैं बचूंगा या नहीं बचूंगा. That is there in camphor. एस्फाइक्सिया नियोनेटोरम इज देयर. बच्चे जो पैदा हुए हैं उनको अगर सांस नहीं आ रही है, देयर इज डिफिकल्टी इन ब्रीदिंग, कैम्फर इज द मेडिसिन. देन एस्थमा फ्रॉम बॉडीली एक्सर्शन से एस्थमा बढ़ जाता है. देयर इज होर्स स्क्वीकी वॉइस, पता नहीं आवाज़ नहीं आ रही है. वायलेंट अटैक्स ऑफ ड्राई कफ इज देयर एंड सफोकेशन, बहुत सफोकेशन फील होता है कि देयर इज डिफिकल्टी इन ब्रीदिंग. Then we have carbo wedge. Carbo wedge में asphyxiation is there, बहुत blue हो जाता है, coldness is there, laborious breathing is there and must be fanned is the ameliorating symptom. Cough is there with burning in the chest. Then after talking with bluish face, cough is after talking, and offensive expectoration is there. Gastric complaint is always associated in carbo wedge patient. Kali Kaap, fifth remedy is Kali Kaap. Kali Kaap में there is stitching pain in the chest. There is difficulty in lying down. Cutting pain in the chest which is difficult, which is aggravated on lying down. Majorly on the right side. Whole chest is very sensitive. Chest का weakness बहुत होता है काली काप में, नहीं चल पा रहा हूँ. Rapid walking is not at all recommended in Kali Kaap. Kali Kaap में aggravation होता है with the rapid walking. There is tightness of the chest and pleurisy is characteristic symptom of Kali Kaap. If you have other symptoms, you can definitely consult.